Drew Tully here with another episode of the Featured Business Podcast on Carter Pod. It is May, which means it's Mental Health Awareness Month. We want to take the time to address the importance of mental health, especially in the older adults in our community, and how we can all work together to break down its stigma. We do have two representatives of the Carroll County Memorial Hospital coming in later on. Mindie Stovall will be our first guest. She works at the Carroll County Memorial Hospital with Senior Life Solutions. With that, let's go ahead and bring in Mindie Stovall and Shelbie Alexander. Hello, Mindie. Thanks for stopping by today. Tell us about yourself and your program, Senior Life Solutions.
Yeah, hi, Drew. I'm glad to be here today. My name is Mindie Stovall. I'm a registered nurse, program director of Senior Life Solutions at Carroll County Memorial Hospital. What we do there is we help seniors in our area with any depression, anxiety symptoms. We hold group and individual therapy for those individuals. We also have a psychiatrist that comes in and sees our patients once a month, as well as a therapist that guides and leads those groups. They can also do family therapy if they would like, and we help them with any resources that they may need in the community.
Well, thanks for telling us about yourself and your program. Now let's dive into what our topic is. What is mental health?
So mental health is really how we feel emotionally, how we control our feelings, how we protrude those feelings outwards. And really, if we're just feeling any sadness, depression symptoms, anxiety, it's really about our overall emotional feelings.
And what is Mental Health Awareness Month, and why is it so important?
So Mental Health Awareness Month used to be Mental Health Awareness Week, and they have changed that to where it is a whole month of awareness that we bring to our communities. Several stakeholders in the communities get together and really try to bring awareness to the community, to raise awareness for mental health and let people in our community know that it's okay to not be okay. It's important to reach out to people, to check on your loved ones, your neighbors, and really just make sure that we're there for one another and helping each other out.
And if any of our loved ones are dealing with some mental health, what is some of the indications of that, some of the signs and symptoms?
Decreased appetite, maybe not sleeping well, feelings of giving up, not wanting to go on in life, selling some of their most prized possessions could be a really good indicator. Really, we see that in our older adults as they move into those later years of life where they get those feelings of just wanting to give up. Their health may be deteriorating. They may not be accepting that well. Feelings of loneliness and isolation are some of the other ones that we may see. We also may see some irritability and protruding that outwards on loved ones that you most typically wouldn't see them acting that way. So those are just some signs that you may notice of your loved ones or neighbors or friends.
And if any of the people that we care about are struggling with mental health, what are some things we can do to help with that?
I just think it's really important, Drew, that we kind of get comfortable with the feeling of asking people if they're okay. I think we don't ask people that because we're afraid that they will say no and we won't know what to do. A lot of people, we may ask them, are you okay? And our response is, yeah, I'm fine. So on the flip side of that, we really need to get comfortable when people ask us that to say, no, I'm not okay. And it's important that we become comfortable in knowing that maybe we can't provide them the help that they need right then, but guiding them and leading them to someone who can help them. And honestly, sometimes they just need to talk. They just need somebody to listen to them, and just getting some of those feelings off their chests will subside those feelings and make them feel better.
Well, thanks again for stopping by today. Do you have any final thoughts on Mental Health Awareness Month or mental health in general?
I will say that I started today, and you may see throughout the month here and there, the rest of the month, I have been putting some rubber ducks around the community. I went out and ducked some of the kids at the school today with some rubber ducks that say, talk about it and stop the stigma. And so we're just trying to raise some awareness in a fun way around the community. I also have a table set up at the hospital. So if you're entering in through the main location there, you will see a table with lots of information. My cards are there. Please feel comfortable to reach out to me. Even if you don't think our program is a good fit for you, maybe you're not age appropriate since we do treat 65 and over, go ahead and reach out to me anyways, because we can definitely try to guide people in the community and help them with some resources that are available out there, and also just be a listening ear for them.
As we continue our Mental Health Awareness Month episode with Carroll County Memorial Hospital, we're joined by Shelbie Alexander. Shelbie, thanks for stopping by today. Tell us about yourself and what you do at the hospital.
Well, first, I will just say that today's 80s Day, so excuse the attire. My name, like you said, is Shelbie Alexander. I'm the Director of Community Health Services, and I oversee the Population Health Department. We live in a lot of different spaces in the hospital. We have a licensed clinical social worker, provides behavioral health therapy, 4 nurse care managers, and a community health worker on our team.
And why is mental health just as important as physical health?
Poor mental health can cause a lot of things like chronic stress, increased depression, chronic anxiety. All of those things really contribute to a decline in chronic conditions, increased blood pressure, digestive issues, all which greatly impact physical health.
And what are some common myths about mental health that still exist today?
I think one of the largest ones is that mental health and mental illness issues make you weak. I definitely don't think that is a sign of weakness. I don't think that's true. I think it's important for people to know that you can still be strong. And actually, I think it makes you even stronger if you're able to admit those issues and reach out for the help that you need.
As you mentioned earlier, you're the Director of Population Health. How does mental health fit into population health?
I would say mental health doesn't just fit into population health. I think mental health is actually a pillar for population health. It's a crucial factor in our physical health. It affects many things like our social, environmental conditions that contribute largely to our physical health conditions. Things like transportation, safety, your living arrangements, whether you can afford your medications, all of those things really impact mental health and are also impacted by your mental health. So,
how can untreated mental health concerns affect overall health?
Untreated mental health issues often lead to declines in already existing conditions. Things like heart disease, diabetes, they also can lead to risky behavior like poor exercise, poor diet, smoking, excessive alcohol use, even substance abuse, which really heavily impact our physical health.
And can you tell us about some of the programs that CCMH offers to help?
Sure. We offer annual wellness visits. Those are for patients 65 and older. Those are preventative screens, depression screenings, any resources that you may need with those visits, and they're annual. Those visits are done by your nurse care manager and a provider, and they kind of hold your hand through your healthcare journey. We have chronic care management, transitional care management. We have a management program for Medicaid patients, and we have a community health worker who provides resources to anyone else in need. So,
and who are these programs designed to help?
Everyone. We have emphasis that we help those that are more likely to develop issues or decline from their chronic care issues, but really we can help anybody who reaches out.
And how do these programs remove barriers to care?
Our programs provide you with nurses and the community health worker that I mentioned to kind of hold your hand or be lending you a hand through your healthcare journey. Every aspect of your healthcare journey, from making sure you receive the care that you need, specialty visits, behavioral health therapy, if that's a necessity, specialty appointments, anything to assist you, everything from insurance to your non-medical needs as well.
How does stigma prevent people from getting help?
I think that the stigma causes people to be embarrassed to ask for the help that they need, especially in a small or rural community.
And how can friends or family help support someone who is struggling?
I think it's important to make sure you're asking the questions. As Mindie mentioned earlier, make sure you're checking on the people who, even the ones who seem okay. Just make sure you're providing that support whenever that people do reach out to you and let you know that there's an issue.
And how can people in need access the programs offered by CCMH?
You can call. You can give us a shout. Anyone at Carroll County Memorial Hospital or Jefferson Medical Group, ask to speak to anyone from the Population Health Department or myself. We can point you in the right direction and help you get the resources needed.
If somebody's hesitant to ask for help, what would you say to them?
I would say find someone you trust, family, friends, anyone to confide in. Let them know you're struggling. If that doesn't work for you, make an appointment with your primary care provider. It's private. You can talk to them. They can also point you in the right direction for the resources needed.
Well, thanks again for stopping by today. Any other final points you'd like to mention?
Just to make sure, like I will echo what Mindie said, that you know it's okay to not be okay, and let somebody know if you're struggling.